Today we are going to present on the topic grief and bereavement. Let's move on to the case presentation.
So, hi, my name is Neha. I'm a psycho-oncologist working in Mazumdar Medical Center. So, I have a case here of an 80-year-old female with thalassemia, which is a blood disorder condition. Can we move to the next slide? Yeah. So the medical history is she's diagnosed with thalassemia at the age of 3. Usually they are diagnosed at very young age. She's a twin sibling, and the twin sibling also has the same disease. And what they get is regular blood transfusion, requiring about transfusion like every 3 weeks they require transfusion. And she had undergone a haploidentical stem cell transplant as a curative option for her disease. And post her treatment, what we noticed is that she's got a lot of post-transplant complications like GVHD, infections, and in and out of stepping into ICUs and all that. They were both psychologically exhausted due to this long hospitalization, and during the transplant phase, they have an isolation which they need to stay at one unit for a month or so. So I'm sorry, can I just take this call? So sorry.
Sure, no worries. You can leave the slide up, Sangeet.
So they were both medically and psychologically exhausted in terms of long hospitalization, isolation. And at this point of time, there are a lot of food restrictions as well, considering her condition and the treatment process. Again, coming back to a guarded prognosis, which is we don't know how she will, will she get better or will her condition worsen? So we were actually there was we were also in a debate as to what would happen in the future. Can we go to the next slide? Yeah. So in terms of insight, the child was aware of diagnosis because at this young age, she's been diagnosed in and out of hospital. So she knew what was happening. Same with the family. Although the child was not aware of how things will be, because the parents did not want to discuss about the same. They said it would it would have a lot of negative impact on the child. So we don't want the child to know what is going on. So there was a lot of hope given to the child. Give us 2 more days, give us 3 more days, you'll get better. Although the family was aware, but they were in denial that it's going on. When though we kept telling them, preparing them for both, but it was mostly like we're not sure what's happening. Just get it. She will be better. So there was a lot of denial. And parent and the child was not aware of the palliative care practices and how it will be and all of that. Though we tried informing them of the same, but they were not willing to accept. Hence, that part of it was not covered. Can we go to the next slide? So this is the genogram. So I'm not sure whether this is exactly how you had expected because we don't use this a lot, but I hope it's clear. So here K is our patient, and L is the twin sibling who is there, and J is the sibling who was the donor for L for the previous transplant. So in the family overview, I will also describe further where. No. So I'm so sorry. So for K and L underwent transplant, which is a lot of financial burden for the family as well. Can we go to the next slide, please? So child K, diagnosed with thalassemia at 3 months of age, was brought to our center for haploidentical stem cell transplant as a curative treatment. Her sibling L was also diagnosed with the same condition and had undergone matched sibling stem cell transplant at a different center, with the elder brother being the donor. And they live in a joint family, a close-knit family. Extended family was aware of the treatment, but again, because they were from UP, they couldn't be there in our center to support them. Although towards the end, that is towards when a lot of complications started, they were all there. They were physically present at that time. Parents were aware of the treatment complications and was hopeful she would make it out of it, as the other twin did. Now, added stressors that played a major role was the financial exhaustion due to repeated admissions, unable to take care of the other children and family. So there was a lot of factors associated with it. The financial exhaustion also because the other twin had undergone transplant, and transplants are generally, they require a lot of money. So financial exhaustion was a lot, adding on to the repeated admission. Can we go to the next slide? So the eco map, with the extended family, there was a very strong connection, and with the siblings as well. With the treating team, not so much, because it was more of an on and off interaction with them. And once they started giving the bad news, the strength of the relationship reduced. Social support was again not, it was positive to only towards the end, because again due to geographical reasons they couldn't all be there with us. It was slightly strong. Again, the reason being, we kept going back to the family, regardless of whether they were okay with us being there or not. So with us, it was slightly stronger. We didn't have a lot of negative effects, although the treating team did report that there was a lot of negative energy around. Can we go to the next slide, please? Now, socioeconomic overview. Parents run their family business, although there were financial burden is high due to previous treatment experience. And they had to stay in a nearby locality because of treatment purposes. They had to be, around the hospital half an hour within to get here basically. And they've exhausted their savings, insurances, and currently relying on crowdfunding and help from their family and friends. Psychological overview. Psychological concerns are written for the child as well as the parents. So psychological concerns are the long admissions, the isolation, upset with food restrictions, anxious about procedures, irritability, feeling of burden to the family. So there were instances where the child told us that, they're doing so much for me, it's taking care of me is a lot of trouble for them. So that is something that came up frequently. Now, psychological concerns of the parents is again the emotional exhaustion, because only one parent was allowed inside the unit, adding a lot of pressure on the one who's inside, taking care of them in and out. The financial burden, guilt and blame. So for deciding to do the transplant, for having come so far, leaving the other children, feeling that it is all my fault. And again, anxious around prognosis, uncertainty around survival as well. Next slide, please. So the total pain, I have tried to incorporate as much as possible. So in terms of physical, there was fatigue, continuous loose stools because of complications, frequent procedures because we had to know what was going on. There was restricted movement, difficulty in sleeping, chronic GVHD, and infections. In terms of psychological, there was irritability, isolation, long admission, and feeling not understood. Both the parent and the child felt their concerns weren't being met. They felt what they are going through, the other person is not understanding. In terms of child not understanding what the parent is going through, and the parents like, I'm doing so much. Can you, in terms of can you cooperate a little more? But both of them having their own concerns was a little difficult. Social economic, the financial burden and separation from the family. In terms of spiritual, there was questioning of faith in religion. That is, they felt like, if God was there, this wouldn't have happened to my child. So there were conversations around those lines as well. So can we go to the next slide, please? So what I wanted to have as a discussion in the class was how do we deal with aggressive extended family? So there was a part we had to cut off. So the extended family, when they had come in because it was a close-knit family, when they had come in, they were really upset with, the treating team and everyone, that when we brought the child in, the child was well. But now that child is not well, it came to a thing where, there's a blame game going on, and there is, it's because of you that this has happened. So there was a lot of aggressiveness in the extended family, although the parents were a little more supportive because they knew what all the child had been through. But for the extended family who's seeing them after a long time, it was more like child was well then and not well now. And breaking the news to the siblings. So considering it's a grief and bereavement topic, what I thought would be a better point, because we are at a guarded prognosis with, again, and mostly at the rate at which is going, the child is unlikely to survive. How do you break the news to the siblings who's an 8-year-old and 11-year-old? And again, dealing with the self-blame and guilt in both child and caregiver. So that's the presentation I had.
Thanks, Neha. Thanks a lot.
Yeah.
I'll just ask Sangeet to keep these last 3 points up for a few more seconds. Dealing with aggressive extended family, breaking news to... I just want to clarify one thing. Did the other twin survive?
Yes, the other twin did survive because that was a matched transplant, so chance of survival was higher. So she did. She was okay, which is why the parents had a lot of hope that, the other twin would also survive.
Okay, great. Can I also, Sangeet, ask you to backtrack to the genogram, please?
Yes, ma'am.
Yeah. I'll just ask you first, Neha. Did you find this exercise of putting a genogram down useful?
On paper, it was easier, but making it here was a little difficult because we're used to doing that on paper. So that was a little difficult, but it was okay because we usually do that in practice as well to get it
Okay.
visually.
All right. Okay, fine. Yeah. I've also really struggled with that drawing of that line and getting it to like be, elliptical or whatever. All right. I want everybody in the group to please take a good look at this genogram. Okay. One thing though, I will encourage Neha, you and others the next step. Even, if it's difficult to do it on digitally, do it on a piece of paper and put a photograph. Yeah. Because what's missing here are the dynamics, the family dynamics. So I'm not seeing what the relationship between various people are in this, which is a little bit of a disadvantage at the moment. Okay. So first thoughts. Yeah, you can stop sharing, please. Sangeet. Yeah. Thank you. First off, I'm just going to invite people to share their immediate thoughts. We're not trying to fix the problem for Neha. We're not trying to immediately answer all the questions she asked us in the end. I just want you to immediately, what stood out for you in this case. If you can unmute or if you can use the chat box. I don't want to spend too much time on this exercise. I'm going to give it another 10 minutes or so. But what stood out, or what has made an impact, or what do you think something is missing? I'd like to invite this group to please just come up with whatever reflections you have. We're not assessing the case. We're not trying to fix the case. I want to see where this case landed with each of you. Is Kavita here? I saw that you said yes, you are in class. So Kavita, Akash, Sudipta, how about you guys? Anything to share? Use the chat box. This is a pretty, yeah, Kavita, come on. You've unmuted?
No, ma'am.
Yeah. So how did this case land with you, Kavita? What did you notice about this case?
Mainly, I felt that the caretaker had a really pressure on actually, and the
Okay.
family support was not that very good. Whenever a problem comes, whenever it's an extended family, they don't support them. Support in a way, they all want to support, but after a point of time, they get irritated and they
Hmm.
don't want to. If it goes on, everybody feels bored. That's that. Even though they all love them, it's not that they don't love them, but still, it's a burden. Becomes a burden to them.
Okay. Thanks, Kavita. Sorry, I'm picking out names at random only because nobody else is
It's okay, ma'am.
volunteering.
No.
All right. Before I pick out the next person, anyone wants to unmute? Lack of emotional and there. See, now the chat box is getting populated. A lack of emotional financial support. Lack of emotional and financial support. Blame game was not required. The child is feeling very sad.
Ma'am, I guess the reciprocity from the patient's family and the professional team affects a lot because since we are working in a common environment, how far the family and the patient is receiving the information, the fact that the professionals are here to support them, so that really matters, I guess, ma'am. So if the professional is full of energy, they are ready to make everything positive, but on the other side, the patient support system or the family aspect is also very important. The reciprocity matters, ma'am. That is what that is what my reflection is.
That's a great point, and thank you very much. I had a similar feeling where when when Neha said that, the treating team thought that the family was withdrawing from them once they started giving them bad news. But the team of counselors and psychologists managed to maintain that relationship, right? Maybe because yours was more supportive in that sense rather than actually giving out medical information. And that's quite interesting, isn't it? Who gets, how the healthcare team is perceived is often based on what the information is that the healthcare team is bringing to the family, and possibly also the way in which it's being delivered. There might be a difference in the style of communication between a team that is trained in counseling versus a team that is purely medical in nature. So that's thank you, Anne, for that. I agree with you. Child is physically and emotionally sad, not able to enjoy early childhood. Yes, excellent point. Caregiver, yes, communication issues. I don't know about counseling not being up to the mark, because I think that's a slightly, we're not here to make judgment statements about that because we don't know. And also different families will respond differently. You can have the best counseling in the world, but if the family is not ready to receive it, then it's not going to make any headway. So I would say we'll reserve judgment on that. Today's class is on grief and bereavement. Yeah. So from that perspective, what do you think is happening with this family here in terms of grief, in terms of, potential bereavement that might take place? We don't know. It's a guarded diagnosis, which means we don't know if the patient is going to survive or not. So from that perspective, where do you think this family is at in terms of grief? Neha, what are your thoughts on it?
So what we had come to a conclusion, or where we are at right now, is that the extended family is in denial now, which is why there is a lot of tension with us and all that. But the parents have come to a state of acceptance. They're like, we understand, which is why they are a little more cooperative compared to the extended family. So they're already grieving, of course. They are grieving because they are aware of what is going on. So I would say the parents are grieving and the extended family is in denial, which is why I feel there is a lot of tension. Yeah, that is what my thought is on where the family is.
No, that's an excellent insight. I think when you are face to face with issues, sometimes your grasp of it is very different from someone like the extended family who came to visit and then immediately got angry with the whole medical team because they felt that the child was doing worse. So yeah, okay. So denial is obviously very rampant here, which is one of the stages of grief as per Elizabeth Kubler-Ross. And we're going to talk about it a little bit here. So we're going to hold some of those discussion points, Neha, to after I'm going to try and cover some of those in the session itself, and then maybe we can revisit it at the end of the hour. Yeah. Okay. So Sangeet and Shri, with your permission, I'll start sharing my screen.
Sangeet, can we give co-host permission?
Yeah, yes, ma'am. Yes, ma'am.
Yeah. Okay. So while we get that done, who in this room has not experienced grief? Anybody in this room who has not experienced grief? Okay. Should we shake things up a little bit, Shri? I should ask the questions that actually require activity. Who in this room has experienced grief? Yeah. Who in this room is awake?
Much awake we are.
Yeah. Post-lunch sessions, like I said, are dangerous. Okay. So who has experienced grief? Partially. Okay. I like that insight of that reflection. Partially. No, I hope it's partially grief and not partially awake, Abhilash. You might need to just clarify that one for me. Okay. And like I said, in the past few years, the pandemic has taken a lot from a lot of people. Grief fully, sleep partially. Okay, at least you're honest about it. Thank you, Abhinash. Get some water or coffee. Okay. I don't know how to make a grief a lively topic. Shri Priya, we're going to have to figure this out. All right. So let's get right into it so that we don't, drag our feet too much. Thank you, Geeta, for that. 614 deaths is a lot, Shivakumar. We'll come back to that as well. Okay. So grief and bereavement is a topic that I have been sort of teaching now for several years. It is a topic that is pretty close to my heart. And it is a vast topic. So what I'm going to try and cover in the sessions this week and next is just sort of skimming the surface a little bit. I am happy to hand notes in addition to these slides at the end of the session, which you can go over. And there's plenty of material out there that is about grief and bereavement that you can also explore on your own. Okay, so firstly, let's talk about the fact that grief and the rituals of mourning are healthy adaptations to loss. There is nothing unhealthy about grief if it is being expressed in a particular way, and it is a healthy adaptation to loss. So when there is a loss, there's this experience of grief, and grief is not a singular emotion. We will talk about that in a couple of moments. And of course, it is accompanied typically in the kind of social fabric that we live in with rituals of mourning. And can you tell me some rituals of mourning from your customs? Some of the rituals we have, like I'm part Nepali, so some of the rituals we have is around food and the fact that nobody in the immediate family cooks for the first week. And food is brought from outside. We don't light any flame within the house. And while there are many superstitions attached to it, I personally believe that it's just to give the family time off, so that they don't have to worry about things like that. And, the neighbors and the friends and family can take that on, because having to worry about what meal to make for whom and with all these visitors, it can be quite a burden on the family. So that is a ritual of mourning where we as immediate family are given space to actually just grieve. And all these practical tasks are taken over by other people in the family. So what are some of the other rituals from your cultures? No celebrations for a year. Yeah, that's a big one, I think, in a lot of cultures. What else? People coming to meet you. Okay. I think in amongst the Christians, you have a wake at some point, isn't it?
Yeah, for Christians on the seventh day, there is a holy mass, and we will go to the cemetery and do the rituals. And also for the 41st day, we have another feast actually. So the feast, the feast will be mostly filled with dishes that is most favorable for the deceased person. For example, if the deceased one is most likely to have some special sweets, so that particular sweet or that particular dish will be on that feast day in memory of that person. So these are the major things in Christianity, and also there will be no celebrations for 1 year, like Christmas and all. We will not celebrate Christmas or any upcoming events like that.
Why do you think it is that most cultures have this idea of, bereavement period of 1 year where no weddings, no celebrations? Why do you think those kind of rituals exist? And also food. See, food is such a big thing. If you look at the responses in the chat box, so much of the ritual is around food, right? So I know in our family, even salt is prohibited for about 13 days. And I really don't understand the science behind it. But a lot of these rituals had their roots in some sort of a practical or something that would be helpful to the family. Okay. And you'll find that a lot of yes, Geeta, thank you for that. So we're seeing that Geeta has given us a more emotional sort of explanation in terms of grief And we also find that Shivakumar has talked about the more spiritual aspects, the existential aspects of that. And various philosophies and belief systems across the world actually have intersections in terms of which day, what is held sacred, and so on and so forth. In Hinduism, we also have the Pitra Paksh time, where it's a time of, remembering our ancestors of 3 generations. So anyway, so these rituals are also meant to aid us in our grieving process. And actually, this year of no celebrations and stuff really gives us that time. Because otherwise, if you're expected to go right back to normal life, then that, I think, really takes away from that experience of grief that every person should be allowed. Because not everybody is going to grieve soon after. For some people, the grief trickles in slowly over a course of time. And we're going to talk about that a little bit more as we go along. Okay, so thank you all for your contributions. So rituals of mourning and grief are healthy adaptations. And we don't just talk about grief in terms of death. Grief is not the experience only when we experience death, right? Grief if we talk about the fact that grief is a healthy adaptation to loss, and in the context of palliative care, when a person has been diagnosed with an illness, there are several losses that the person experiences and the family experiences before the actual bereavement, which is the death of the patient, takes place. What are some of these losses? What are some of the losses that people experience as their illness and disease progresses? Any thoughts? What are the many things that people lose along the way? Let's get you started up. One of the things that we lose is our identity and our customary roles. We've talked about this a lot over the last couple of sessions that I've had with you. People lose their sense of identity. They lose their customary roles. I am mother to 2 children, and suddenly now I'm just a cancer patient, and I'm not really the nurturer in the family. I'm not really the breadwinner. I'm not the provider anymore. So those are the customary roles that we hold that the disease takes away from us. What else? You can see I've left a lot of space here, so that means there are many things. So you're going to help me fill up those spaces. What are some of the other losses that people experience? If I'm not seeing the chat box, Shri, please read it out to me. Sometimes my laptop acts up. Okay, there it is. Empty chat box. Okay. Financial security. Thank you, Ashwati. A very important point. Financial security is a big one. What else? If you have experienced or if you have witnessed illness, what are some of the losses that you have experienced along the way? Fear of disease that may affect siblings and children. Okay, I'm not seeing that as a loss specifically. Status in society, emotional support, yes. Acceptance amongst peers. Independence, yes, is a big one. What did we talk about the last time when we talked about mental health? What do people lose when they are diagnosed with a serious illness? Roles. Sense of security being utilized by others, okay, being like a contributing member of society. Peace of mind is lost. Okay, fine. All right. Loss of identity, purpose, relationships, income. Yeah. So keep your responses coming. Physical function, most obvious. I've been diagnosed with a disease. It's taken away some physical function. I might have, lost my ability to do various things physically. I might lose my strength. I might lose a limb. I might need an amputation, some surgical intervention. I might lose my, mobility. So these are all physical functions that we lose. So that's a big one. And if you lose your ability to do certain things by yourself, what we call the activities of daily living, the ability to bathe yourself, feed yourself, those kind of things, transferring from your bed to a chair, transferring, toileting, like those kind of things, physical function. Relationships, somebody mentioned that in the chat box. Why would we lose relationships as a result of disease, though? Huh? What kind of relationships do we lose as a result of disease? What would make us lose relationships if we were sick?
Can I add a point?
Yes, Neha.
So I feel in terms of relationship, there can be a little bit of ego clash in terms of you didn't tell me that you were doing this. In terms of treatment decisions, you didn't tell me that you were going through this. You should have asked me. Financial independence, it can be financial issues as well. Like they weren't helping me when I needed it. I think a lot of clashes like that is commonly seen here as well.
Absolutely. And, and also just to remind you what we talked about in our first session on assessment, coping styles, right? So if a family already is dysfunctional to begin with, a crisis like this will make those relationships worse. So if there are people who experience conflict, likely that conflict is going to get worse. This blame game, this guilt tripping, things like that. Extra responsibility that Jayapakya talked about. Yes, because now as a caregiver, I have so much more to do. I don't have time to even go out and meet my friends or, meet people that I would regularly meet up with. One, I may not have the time. Two, I might feel too guilty as a caregiver to take time out to go out with my friends and do something relaxing. So those relationships slowly fall away. Okay, I'm looking at... Yeah. And also relationships in terms of if it's a disfiguring disease or if it's a stigmatized disease like, say, HIV, tuberculosis, things like that. If it's a disease that is mired in superstition, for example, people, neighbors, friends will start dropping away. It's isolating. Now, if it's a disfiguring illness, what might also happen is that the patient themselves doesn't want to meet anybody because they are not feeling good about themselves. And so a visitor might come once, twice. By the third time, they feel awkward about coming. By the fourth time, they say, you know what, maybe I'll go next week. And then they stop coming altogether. So relationships slowly disintegrate. Anukriti, you're talking about gender bias. Some parents, when with female child, can you just expand on that a little bit, please? Anukriti Srivastav, gender bias.
Hi, ma'am. Actually, when in our center, most of the parents, when listen that their that girl child have any diagnosis like cancer or hemophilia or thalassemia, most of the parents will withdraw the treatment that they don't want to treat the female child.
Yeah. Which part of the country are you in, Anukriti?
I'm in Noida, ma'am.
Okay. Well, thank you for telling us that. And that really talks about how deep-rooted this kind of misogyny really is. And thank you for reminding us that that is not a thing of the past, that it is very much in our present. And we need to be alert and vigilant about this kind of bias. So thank you. That's something for us to note. Okay. Other losses, material and economic. Somebody talked about financial stability. Time. Where does all the time go? The time now only goes in caregiving and procedural interventions and medical stuff. No time for anything else. Opportunity. I was up for a promotion when I suddenly became a caregiver. And now I've lost that promotion. My, a young boy is supposed to go abroad for college, but suddenly that tuition fee that is now that was going to be put aside for that college education is now going to go towards the cancer treatment. Various things. Yeah. So we lose opportunities. Plans. Like I said, how many of you made plans in 2019? And what happened to those plans? So plans are completely derailed when illness hits. And whatever plans we might have, whether it's to move house, whether it's to get married or whatever it might be, those plans get derailed. Autonomy. One of the biggest casualties of illness is autonomy. The minute I am diagnosed as having a disease, I am now everybody's property. Everybody's going to make decisions about me, my medical team, my family, my friends. Even the neighbor who lives 3 doors down has a say in what's going on with me. Right? Somebody will come and say, hey, my uncle's cousin who lives in Fatehpur, he has had this experience. Now he's telling you that you should try this. Everybody has a say in what you shouldn't be doing, and that sense of autonomy is deeply threatened at a time of illness and disease. Control, we talked about this in our session on mental health. We lose our sense of control. We actually lose, it's not just a sense of control, we actually lose control of our lives, because everything depends on every next investigation outcome. I'm going to do this test, we're going to wait for the results. Depending on the results, we're going to make the next move. So we are really not in the driver's seat anymore. Dignity. And I wish we could spend more time on this. What does dignity mean? What does dignity mean to you, each of you as people? I want to know what dignity means to each of you. What does the word dignity conjure? When I say your sense of dignity, respect, okay, what else? What is dignity? Honor. Any more words? What is your dignity based on? And how do I know what dignity means to you? Status in society. So basically perception of people that they have of you. Ethically being treated, independence, self-worth, self-respect. Yeah. Capable of deciding and doing. So see, if I ask 10 people what dignity means, I'll get 11 answers. Dignity is one of those words where it's like love or joy. We know it's important. We know that it has to be a part of our lives. But when you break it down, it means different things to different people. There are people who don't mind being cleaned up by their children. Everything from, bedpans to being washed or cleaned. They don't mind. They surrender to it. They'd rather have someone take care of them. There are people for whom that is a complete assault on their dignity, that somebody else has to do it for them. And in my case, when I was very young, so I grew up one of those few people who has had two mothers. So my Masi had adopted me. So at a very young age, when I was very young, she was diagnosed with cancer. And one of the things that really, really upset her was that by the time I was 18 years old, I was basically giving her sponge baths, or I was taking care of her. She couldn't go to the toilet anymore, so I was helping her with that. And for her, that was the thing that hurt her the most, that it had come to that point. And she was very proud in terms of how she turned out and how groomed she was. So that meant a lot to her, to be well turned out. And she was one of the most elegant women I knew. But suddenly all of that was gone. And that was an assault on her dignity. Whereas for my birth mom, who passed away this year, she was okay with it. She was okay to have somebody else look after her. She was okay to have somebody else do these things. So for different people, it means different things. But in this case, like for some people, they don't like to be challenged in the decisions that they're making for themselves. And they will hold on to that to the very end, because that's what dignity is. For some people, it's just how they're being addressed. Are they being called, especially older people? And sometimes there's a tendency to talk down to a patient, right? Not forgetting that this guy was probably the head of department of a major university, who's worked very hard all his life, who's a very accomplished human being. And now he's been reduced to just a number on a chart. So that's dignity as well to different people. And not even able to do activities of daily living. Yes, that's a loss of dignity as well. So many things mean different. Dignity means different things to different people. And I'd like you to reflect on this. Where is your dignity tied in terms of your, sense of self? And finally, a functioning member. So whether it's a functional family or a dysfunctional family, every person fulfills a particular role. And this is something that the disease will take away from you, where it takes away a functioning member. Now, all of these different things, although these are just subheadings, There are lots and lots and lots and lots of different things under each of these points, and all of them warrant grief. If I lose my sense of identity, I am well within my right to grieve over it. So we're not only grieving the loss of a life, we are grieving all of these things. So grief is not something that we experience at the end of somebody's illness. It is something that is constantly accompanying us throughout. And grief is a total human experience. It's physical, of course. How is grief physical? How is grief physical? If I were to ask all of you today, where do you feel grief in your body? Tell me. When you feel sad, where do you feel it in your body? Mind, heart. Okay. Energy, chest, stomach, heart. 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 Everyone say heart. Okay. I'll say heart and chest around the same. Okay. Where else? Where else do you feel grief? For me, an instant thing is I can't sleep. I feel it in my sleep cycle. Pain in the heart, crying. Yeah. You know, those prickling tears behind your eyes. Physical. Yeah. So it's a physical experience, right? We can't deny it. And for some people, it's a knot in their stomach. For some people, it's a tightness in the chest. For some people, it's just this, it's a headache. For some people, it's just lethargy. They can't get out of bed. So different people feel different things when it comes to grief. So there's no denying that grief is a powerful physical experience. Cognitive. By cognitive, I mean mental processes, higher order functioning processes. Like, for example, problem solving, decision making, concentration, attention, all of these things are also affected when you are grieving over something. Yes, it is a spiritual experience, of course. You, Neha shared with us, they were questioning their faith in God. Spirituality also has to do with connection, with meaning, with purpose. Who am I if I'm no longer the breadwinner and the nurturer of this family? What is my role? These are all existential and spiritual questions as well. And if I can't be a teacher anymore, if I can't be a doctor anymore, then what is my purpose in life? So it's a spiritual experience as well. Emotional, of course, we know there are various emotions attached to it. It's not just sadness. People feel repetitive thought of grief. Thank you, Vishwanathan. Repetitive thoughts of grief is also a cognitive thing as well as an emotional thing. And of course, social. Grief is a social experience. Grief affects the way and is influenced by the way we are connected to other people. How much of support systems do we have? Who are we connected to? Who's our source of strength? And all of these things is a social experience. Rituals of mourning, those are social manifestations of grief as well. So grief is all of these things. It's not just emotion. Yeah. And there are many factors that influence grief. Now, I'm going to talk about just a few. Now, those of you who are psychologists here might be aware of attachment styles. For those of you who are not, I have referred to Mary Ainsworth studies. The attachment style basically talks about the ways in which we attach, and this comes from childhood. So as children, as very young children, we attach in particular ways to our primary caregivers, which is usually, ideally, our parents. And different people have different ways of attaching. So that depends. Now, for example, if I am securely attached, that means I have this confidence in my relationship with my caregiver, and I am able to feel a sense of safety around them. I know that if they leave the room and come back, if they leave the room, they are going to come back. I'm assured of it. Now, there's insecure styles of attachment where, because they're never really quite sure how the caregiver is going to respond. I'm talking about very young children. I just want to remind you. Some kids are absolutely unable to be left alone even for a few minutes. And you'll find them screaming because they're suddenly very insecure. They have separation anxiety. They don't know if the caregiver is coming back. That's insecure. You have avoidance styles. You have all kinds of styles. I won't get into the details of it. But the way we attach to people very young pretty much defines in some ways how we form attachments with significant people in our lives for the rest of our lives. Okay. And also it affects how we treat grief and loss. Now, a person who is insecurely attached is likely to have a much more dysfunctional reaction to the person who has died. I mean, when the person dies, than a person who is securely attached, has a healthy bond with the person. There's open communication between them, and somehow they've gone through this whole journey together. Chances are that they will probably have a different style of coping. I'm not saying one, I mean, yeah, there are templates to how this works out, but these are just some examples that attachment styles, how we attach to significant people in our lives, definitely has an impact on how we will behave when that person dies. Okay. And family structure, we talked about this in the genogram, which is why that genogram, the dynamics are very important as well. Who is close to whom? Now, if you talk about the family that Neha shared with us, what is the relationship of the older sibling with the younger sibling? Who talks to whom the most? Are the parents a well, connected unit? Do they take decisions together? Are they in harmony with one another when they make important decisions, or are they conflicted? Okay, what are the boundaries? Are they willing to be open to including other people, or are their boundaries so defined that they're not going to let anybody else near them? Okay, or the boundaries get more defined if they get bad news, for instance. Now, if you see, she talked about how the family has withdrawn from the medical team. That is an example of boundaries getting strengthened because they as a family are not able to handle bad news. So that's one. But it seems that they're working in tandem there. And flexibility. How flexible is the family when it comes to a crisis? Are they able to adapt? Are they able to cope? Are they able to move with the crisis and pivot with the crisis? Or are they so rigid that they're going to only deal with it in this way? And if it doesn't work, it doesn't work, but this is the only way they're going to deal with it. Okay, so family structure. Communication patterns within the family. Who is the decision maker? Who is the person that they go to for advice? Who is the person who is rational and is able to problem solve? Who is the emotional communicator? Who doesn't talk to whom? Who absolutely doesn't go near the other person? These are very important things when it comes to grief. Now, as a family, if we experience grief, then I will probably rely on some people more than I rely on others. Okay, I may not go to somebody who's within my immediate family because they have outbursts of emotions that right now I can't handle it. Okay, so that's going to affect the way I'm able to support them and they're able to support me in our grief. And one thing is it's quite essential. I'm going to constantly pepper this with personal examples. For a long, my birth mom was sick for a very long time. She had mental health challenges for a long time, and then she had a very serious illness. And my brother and I, for the most part of our adult life, our conversations would be only about her. It would be, yesterday was a bad day. Today was a bad day. She called me in the night. She's going through this crisis. Okay, we're handling it like this. I'm going to handle it like that. This is what you can do. This is what I can do. And I remember there came a point where she got seriously sick. And there was a time when Dr. Rajgopal asked me, he said, what do you and your brother talk about? And I said, we only talk about my mother. And he actually said, well, it's high time you guys start getting to know each other outside of your relationship with your mother, because there's going to come a point where your mother will be gone. And then what are you guys going to talk about? And I think that was a very remarkable insight that, Dr. Raj as a mentor gave me, because even someone like me who's been in palliative care a long time needed that reminder. Communication patterns within families after a while become sort of habitual. And in a crisis like this, it's really important for us to examine those communication patterns and see where it could be improved, where we can be more supportive of each other, and where we can make it not just about the disease and the illness. And social support. As a family, we're engaged with the larger society and fabric around us, and therefore we're getting more help and support, versus a family that says, no, I don't want this. We're not going to allow anybody in, and we're going to do this ourselves. So that could become more dysfunctional, and that could enhance the internal dysfunction within the family. So all these factors influence the ways in which we grieve. Now, human attachment, the way we attach to one another, if it happens right, it's a developmental milestone. Okay, it is a task as humans, just like, physically, biologically, and neurologically, we have tasks that we accomplish at certain milestone ages. Similarly, human attachment is also a particular task. I need to learn how to attach myself to the people around me. And how one handles separation from attachment figures can either result in growth or it can result in pathology, which means unhealthy outcomes. So this is a little bit of a psychological slide, but we're going to move on from it. But it's really important for us to remember that how we respond to loss and grief and death has a lot to do with the relationship that we shared with the person. So it's not a one size fits all. It is very, very individual. Okay. There are three sides to grief. One is the way in which we experience it internally. One is the way we externally express it. And the third part is how we, while we do this, how we adapt to the loss. Okay. So how we experience it internally, how we express it externally, and how we adapt to the loss. This is from Doka and Martin. They have theories and contemporary theories on grief. Okay. So this is one of the more recent frameworks. Now, earlier, people used to talk about masculine and feminine ways of grieving, right? Boys don't cry. Women are more emotional. Yes or no? How many of you have experienced these stereotypes? Is that something that we come across quite? You haven't experienced it? Okay, that's great. That's a rare person who hasn't grown up with those. No, I'm saying, yeah, that is a myth, but I'm saying what is projected to us socially. What is projected, what the expectation is. Men are supposed to handle it with less display of emotion. I'm happy to see that that's not the reality for two people in this group. But what about the others? We talked about gender bias in the hospital. Do you think there's a gender bias when it comes to grief and how we express grief? To be strong and not display emotions. Okay. What else? Do you think there is expectations on, older children, younger children, how they're supposed to respond to grief? Say a parent dies. You guys don't have any stereotypes around grief and gender in what you've come across growing up? Seems like a very level playing field suddenly. Anybody?
Ma'am, even the social worker is not allowed to cry, ma'am. They say you're a social worker, you're not supposed to cry. Even when my brother died, they said that. And I didn't cry. After 14 years, I cried for him one day. That's what happened.
I'm sorry that was your experience, Kavita, but thank you. That is such an important point. And we're going to be talking about that particular kind of grief as well. Male members usually try to handle the situation, though in critical times. Okay, fine. But that is the expectation. Is it that women can't handle critical situations? Strength and weakness, correct. Okay, so anyway, historically, that's how we have perceived it. That, yeah, it's okay for girls to cry. It's not so, why are you crying like a girl? Don't be a sissy. These are phrases that we've all grown up with. If you're the Doordarshan generation, we've grown up with this kind of stereotyping. Okay, and so there was a move then. Like there were people who realized that this is not okay, and then they tried to sort of move it from male and female to say feminine and masculine. But then that also what they found was problematic because you're still underscoring this sort of gender bias. So finally, these theorists came up with this idea of intuitive and instrumental. And this is gender neutral. Okay. So what does intuitive and instrumental mean? Intuitive refers to people who are able to invest energy in affect, which is mood, emotion, feeling. They spontaneously are able to express their feelings and they can share their inner experiences. They don't have a problem with it. Instrumental people are people who put more of their energy into cognitive and intellectual aspects, and they prefer to discuss problems over feelings. How do we fix this? Okay, let's just get this going. And you'll find that in all of us, we have both these. You might be intuitive with loved ones, you're more instrumental at work. You might have suffered a loss, but when you go to work, like Kavita said, social workers are not supposed to cry, right? So you go into immediate problem solving mode. This is how we're going to deal with it. And sometimes that might overlap with what you bring back home. Now, but different traits come out at different times. Sometimes intuitive is more dominant, instrumental is more dominant. It does depend on context. And again, a woman could be more instrumental, a man could be more intuitive. It doesn't matter. Now, if you were to see a woman who is cold like ice at a bereavement and just going around organizing things, what do we typically hear from, maybe not from the immediate family, but from people in the audience? Is there some commentary around that? Like if a woman just goes about very business-like sorting out all the issues rather than actually sitting and expressing her emotions. There is an expectation around how a woman is supposed to grieve. Or what happens if maybe a man is, doing all the crying? Or in the case of children, sometimes we hear we hear elders telling the sons, now you're the man of the house, so compose yourself and make some, you're gonna be the decision maker. And children are expected to grow up very quickly. So a lot of these sort of stereotypes trickle down, multi-generational, and they sort of follow us around where we go. Now, there are those that are blended. Like I said, we're able to shift between the two, but then there is those that are dissonant. And because some people might grow up in extremely stereotypical, gender stereotypical backgrounds where they might feel intense emotion, but society has told them they cannot express it. So this is a dissonance between what we experience on the inside and what we are able to express on the outside. And if they're not allowed to meet, if I'm not allowed to express my emotion the way I'm feeling it, I am going to feel dissonant. Okay, it's going to be a mismatch inside me. I'm going to feel it. Okay, now very quickly, we've all heard about Elisabeth Kubler-Ross. She is the first thanatologist. Excuse me. Thanatology is a study of death and dying. Elisabeth Kubler-Ross was a leader in thoughts around death and dying and palliative care. And and she talks about stages of grief. The problem with this particular framework is that people over the years have misrepresented it to mean that you have to go through these 5 stages in this order. This denial, anger, depression, bargaining, and acceptance. Is this true? I mean, the answer is on the screen, but is this true for you? Have you experienced it in this sequence? It's not necessary that this is experienced sequentially. It is not even necessary that you have to feel all 5. There are people who may not go through the depression stage. There are people who may not go through the bargaining stage. There are people who might accept what has gone on. They might accept that, yes, this loss has happened, this death is happening, and yet they can be angry at the same time. So the 5 stages of grief, unfortunately, the way it's 5 stages of grief, stages automatically implies that we have to pass through one to get to the next. That's not how it is. It's just a broad framework of how different emotions can exist, and it can be quite messy, actually. More contemporary are other theories. Strebe and Schutt in 1999 talked about grief as a two-dimensional process. They said there's a part of it that is loss-oriented, which is, I'm going to cry, I'm going to feel sad, I'm going to deal with the loss. And then there's a second part, which is restoration-oriented, where I have to get on with my life, and I have to get on with my, caring for my kids, getting up in the morning, going to work, etc. So that's restoration-oriented. And I can oscillate between the two. It's not necessary that I will only stay stuck in one. And sometimes I'll spend more time in loss orientation stuff, like when on anniversaries, on milestones, on holidays, things like that, and restoration oriented. So over a period of time, we go more from loss. We spend more time in restoration oriented activities. Yes, Jayanta, you have your hand up.
Yeah, ma'am, I was just thinking, what if somebody fails to grieve in certain situations that calls for the same? So how do we address that?
If they fail to grieve?
Yeah.
So what do you mean by failing to grieve?
What I want to mean is that we have certain formats or standard practices of grieving, as we are discussing. That anger and all that, the types of grieving. So if somebody doesn't react in any of these situations, in any of this manner, then how can we explain the mental state, or what do we expect out of it?
So I would say the question here also is, in what duration of time? Are we talking about within 5 months? I mean, about within a month, within 6 months, within a year? What are we talking about? The duration is important. If somebody is at zero numb affect for that long, it's very likely that they could be depressed, right? Because we did talk about depression as being as a flat line affect, and you're not seeing any of these major emotions. So that's when I would probably screen them for clinical depression, Jayanta. Yeah. But so I would say that the marker there would be the amount of time that has passed. Because let's remember that for some people, there is something called delayed grief. I might be and I'll tell you this, I experienced this where soon after my mother's death, I was so embroiled with so many different things. My brother was sitting next to me. He went through the whole process of crying, being angry. I felt nothing till about June, July. And even now, I don't feel like I have completely felt it or experienced it. Also because delayed grief probably has to do with having to take care of a lot of things along the way. Okay, so you don't give yourself permission to go through it. So I would say observe the person over a period of time. And if it is starting to seem dysfunctional to you, then please screen them for depression. Yeah? Did I answer your question?
Yeah, ma'am. It's very clear. And actually, the answer is, so this is calling for a psychological screening or emotional screening, isn't it?
I would say, till about, we're going to be talking about complicated grief, Jayanta. So can we hold on till that?
Yeah, please.
Yeah, okay, because then I think we're going to be covering some of that.
Yep.
Yeah,
sure.
All right. Thank you very much. So, all right. So this is the second framework that I'm showing you. I'm not going to spend too much time. It's pretty self-explanatory. Loss orientation, restoration orientation. We oscillate between the two. I like this one, William Worden. I'm not trying to influence your approach, but William Worden talks about the fact that there are certain tasks that have to be accomplished in the process of grieving. Okay. And this is based on the developmental psychology model. So just like a child is required to accomplish various emotional, social, physical, and mental tasks to adapt, so does a person experiencing loss, grief, and bereavement. And mastery of one task impacts the mastery of higher order tasks. I'll tell you what the tasks are. And it doesn't mean that we can never go back to the previous task. We will, but I need to master this before I can actually start tackling the next one. And I might revisit these tasks over a period of time. And these tasks are influenced by what we call mediators of mourning, which is a fabulous way of looking at grief. And I'll share that with you in just a moment. So what are these tasks? According to William Worden, and this is a 2008 framework, so way after Elizabeth Kubler-Ross. Okay, so first is to accept that the loss has happened. Accept it. And that acceptance is not just verbal acceptance. I might say, I have accepted this loss, but I am not throwing out my mother's clothes. I'm leaving her room exactly as it was. Every morning I go and I do something that is, you know, that she used to do in that room. Have I accepted the loss? Now, some people might say, no, this is their way of honoring the dead. Fair enough. But what about people who keep, you know, that room like a shrine for like 10 years or even for like, say, 2 years or 3 years? Have they accepted the reality of loss? And sometimes it's not even something that big. Again, I'm going to be constantly using my own examples. My mom died in Feb. Sometime in May, I was cooking something that she taught me how to cook. And very thoughtlessly, I picked up my phone because I had a doubt and I dialed her number to clarify my doubt. Now, there are many ways that we can unpack that, right? It's just habit. But the fact that she'd been gone for like a few months hadn't occurred to me in that moment. Now, there's a beautiful book by this lady called Joan Didion. She's one of the finest authors in the world. And she's written a book called The Year of Magical Thinking. And for a lot of us, that first year is full of magical thinking, where we think that when we come around this corner, we're going to run into that person. Somebody's perfume reminds us of that person in a very, very sharp way, or things like this, like I'm picking up the phone to call my dead mother to ask her for a recipe. So these kind of things, they will keep happening, but over a period of time, eventually we learn to accept the reality of loss. The next task is then work through this pain of the grief, to process it. And the pain of grief is not necessarily only sadness. I might have had unresolved issues with the person who died. I might have had a conflicted relationship. I might have left things unsaid. I might have, basically unfinished business with that person. And I need to work through it. I need to either, be able to accept that this person is gone. And so they say that's a very interesting thing. There are 5 things that people ideally that we should focus on when someone is at the end of life. The 5 things that we should be talking about is I love you, thank you, I forgive you, please forgive me, and goodbye. And many of us don't get to say any of these 5 things. So that's sort of working through, forgiving somebody or asking for forgiveness or those kind of things, working through that pain of loss. Now, adjust to an environment where the deceased is missing. Now, this could show up in practical ways. It could show up in emotional ways. It could show up in various ways. Okay. Now, it could be the fact that, it could be a spouse who's lost their partner. And it was their partner who used to, handle all the mechanical and electrical and practical issues in the house. I may not know how the plumbing works. And suddenly that person is not there. And I have to, these are things that I need to adjust to. These are secondary losses that I'm adjusting to. Because with their death, a whole lot of things has gone with them, right? It could be that, my mom knew how to handle particular neighbors. I don't know how to do it. Now I have to learn how to step into that role. It could be that that person was the one who really was the person who handled all the finances. And now I may not know how to do that because I've always depended on them to do it, right? So I need to adjust to the environment where the deceased is missing and adapt to it. And finally, to emotionally, spiritually relocate the deceased and re-engage with life. What does it mean to emotionally and spiritually relocate the deceased and re-engage with life? It means that if somebody dies, does that mean my relationship with them is over? No. There are many of you here who have experienced profound loss and profound grief. Okay, so I would ask you, just even if it's been 13 years for Kavita, is the relationship with her brother over? It's not, right? For those of us who have lost people as recently as, this year or a few years ago. So just because the person dies doesn't mean the relationship is over. Now we need to find a spiritual, space for them where we can visit them, where we can have a conversation with them. And for a lot of people, like, it could be in the form of prayer, it could be in the form of ceremony, it could be in the form of a scholarship fund that they have started in their name. It could be in the form of planting a tree every year on the anniversary. So that's where they spiritually relocate the person, and that relationship continues. And so once they are, we know they're always going to be a part of our lives, but at the same time, we are moving on and we are getting back on our feet. So that is what it means to spiritually relocate somebody and then re-engage with life. So that's wording. And I think what I'm going to do is, we'll check on the time. This is something that all of you who are experiencing settings where you come across people who are grieving, or people in like settings like where perhaps Neha is working in, hospital settings, healthcare settings, where there is a likelihood of serious advanced illnesses that might be life-threatening, life-limiting. Mediators of mourning is a very important concept. What are mediators of mourning? Okay. Who died? Very big question. Who died? So it'll be, okay, my spouse, my child, my parent, whoever. But it's very important. Who died? What was the nature of attachment? Was it a conflicted attachment? Was it an insecure attachment? Was it a very, very were they over dependent on each other? Okay. Or was it a healthy attachment where, they were able to resolve conflicts, etc., where they are able to lead separate lives while being supportive of one another? What kind of an attachment was it? What type of death was it? Sudden, unexpected, expected, painful, alone, surrounded by family. What was it? What kind of death? Was it a unpleasant in the sense, was it a where the pain was not controlled? Was there a lot of suffering involved? What kind of death was it? How does this loss impact the person's sense of self? I am now nobody without that person. The one person who really wanted me to succeed in life is gone. Nobody else believes in me. Or it could be the other way. I knew a woman whose husband was an abusive husband for a very, very, very long time. And he died after a very prolonged illness. Suddenly, this woman was free. But she didn't know at the age of 55 what to do with her time, because her whole life she'd been controlled by this guy. So it meant re-engaging and learning how to make friends, stepping out of that zone, learning to trust people. So how does a loss impact a person's sense of self? Okay. What is your previous experience with loss? Is this your first loss? Have you had many losses before? Is this a series of losses that you're experiencing one after the other? Okay. How well or badly were earlier losses handled? Because this will give you an idea about somebody's sense of tenacity, resilience, coping mechanisms, styles. Okay. What was the level of social support that is available to them? Very, very big one, this is. What are the secondary losses caused by the death? Suddenly, are they in debt because they didn't have any control of the finances? Are they suddenly, they've lost status in society or in their community because of the death of this person? Have they lost, maybe other relationships? What are the secondary losses that have been caused by this death? I have to give up my job now, and now I have to do this. I have to move to another city because suddenly, my one has died, my other parent is alone, so I need to go and look after this other parent. So now I've lost, whatever, my job here. Now, a counselor, and not just a counselor, anybody in palliative care or in healthcare, you cannot help people with tasks of mourning if you don't understand what the mediators of mourning are. Because for every single person, the mediators will decide and define the kind of grief that they're experiencing. There is no formula. Now, to Jayanta's question, if somebody is not showing the standard responses, then what do? Go to the mediators of mourning. I think you'll get some ideas here, Jayanta, of what is missing, what is causing that numbness. Okay. You might find that they will not even engage with you on this, but these are very, very important indicators of how we can help somebody. We cannot go and give standard advice. What worked for me will not work for you. Okay, what worked for my other patient is not going to work for them, even though it's almost the exact same case. It won't work. So please figure out these mediators of mourning before you try to assist somebody in their tasks of grief. Okay. And know that grief and loss don't exist in a vacuum. Even though you might be like a extreme introvert, you still have a place in society. You still have a place in a community. And grief is always like this concentric. Okay. Very quickly, I'm going to go through anticipatory grief. This is grief that is anticipated, is felt in anticipation of a future harmful occurrence. I know this patient is now terminally ill. Now, in the case of this little child that Neha shared with us in the beginning of the session, there is anticipatory grief here. The parents don't know which way it will go. There's a good chance the child may not survive. That anticipatory grief is already setting in. I think perhaps, if you don't have a straight up prognosis that yes, she's going to make it, there is, along with the uncertainty, there might be a little bit of grief involved. And it has a lot of fear. There's fear of the unknown, what's going to happen, fear of loneliness for the patient, because I'm going through this alone, nobody understands it. The loss of family and friends. And this is an important one. Loss of family and friends. I remember when I was 19 and when my first encounter with death was my adoptive mom. And I remember there came a point where she started getting very emotionally volatile. And I was like, we were each other's favorite people, but yet at the time I was thrown out into the corridor of the hospital and not been allowed to talk to her and things like that. And I was wondering why she's behaving in this way. And it was my dad who actually sat down and said, imagine for you are preparing for the loss of one person. Imagine for her, she's preparing for the loss of all of you. So loss of family and friends is for both the caregiver and the patients. Okay. The patient is also experiencing this impending loss. Loss of body function. We've talked about tomorrow. If you couldn't use your hand, that would make you feel quite bad, isn't it? And these kind of fears. Oh my God, is this disease going to take this away from me? Is this disease going to take away this from me? And loss of identity. People are not going to remember me for what I was. Legacy is very important. People want to be remembered for the good that they have done, for the accomplishments that they have achieved. And suddenly the disease is a threat to all of those things. I'm not going to get into complicated grief right now. We'll go into it next session. I'm just keeping an eye on time. So coming back to Neha's presentation, I'm also going to be touching upon, so I'm going to ask that the next session's presentation be held, Shri and Sangeet, because we're going to come back to Neha's presentation, because there is also a section I'm going to cover on how to communicate with children at a time of grief and bereavement. And I think that will give us some sort of idea of how we can cope with this particular family that Neha has presented to us. We have about 6 minutes. So just to recap, we've talked about what grief, the fact that it's a healthy adaptation to loss. We've talked about the fact that there's various kinds of losses that people experience in the course of this journey. It's not necessarily only death. We've talked about the different frameworks and the fact that there are ways in which we experience it, there's ways in which we express it, and how we adapt. And all of these three things ideally should be in sync with one another. If they are not in sync with each other, then we experience difficulties and disorders. And we've looked at grief through 3 frameworks, although I will tell you that there are many, many, many frameworks to grief, but it's entirely up to you which one you want to go with. Elizabeth Kubler-Ross's 5 stages, of course, is the most commonly known. Strebe and Shute is what I introduced you to, which is orientation, and William Worden's tasks. And for me, I have found repeatedly in my experience with patients and their families, the mediators of mourning really are a great way to signpost me to what their internal inner landscape is like when it comes to how they experience grief and loss. And we've touched upon anticipatory grief. Next session, we're going to talk about complicated grief, disenfranchised grief. We're going to talk about children, and we will close up with bereavement. So, heavy topic today, but very quickly can ask everyone to put their cameras on. And I'd like to gather some reflections from people. I can see that people have shared some deeply personal things in the chat box, so maybe we can spend some time here. Can we say grieving is not necessary, or is it natural? Sudipta? No? All right. So, Shivakumar, is that a question you would like me to answer, or is that a rhetorical question that you have asked? Let me open that question up to the rest of the group. Is it natural for all humans to grieve?
Yes. It's a natural phenomenon.
Yeah.
If it is not grieving, means there is something abnormality.
Yeah. Grief is actually, I would say, a marker of humanity. Not just something that is optional. How we grieve, how we experience grief is pretty much a direct relationship to our humanity, in my opinion. I'm very sorry for your loss, Shiv Kumar. 5 weeks is not a long time at all. Yeah, Neha, do you want to expand on that a little bit? The ways people might show it?
Hi, am I audible? So what I feel is that for some people, if we don't in cultural aspects as well, so if you don't cry, if you don't, if you're not really, say cry next to the person, if you are not, say, being weak or showing that sadness, then that might be considered as something that, you are not grieving. Aren't you feeling sad that this person is gone? But for maybe that person, it might be a very personal thing. They might be, they might like to show it, or they might like to grieve in a personal alone time. They may not want to do so. And so there are also comments that I have heard other people say that, look at her do all this, how can she be, so the mother, she was, so for one of our patients, the mother was taking the decisions on, what clothes the child should wear, because I primarily work in pediatrics. So what clothes the child should wear, what should, how should they take the body home and things like that. So I have heard comments from other families, other parents saying, how can she do that? She's supposed to be grieving the loss of her child. She should be doing this. There are so many shoulds and shoulds that this is the way you're supposed to do. I think you should always respect the fact that it may not be ABC for everybody. It might just be LMNOP for another person, and that should be given that respect. But a lot of the times, because these cultural things are also there, like we've already discussed about what are the cultural rituals that we do. If anybody deviates from that, they are not considered, say, human, or they are not considered as this is not appropriate. That's what I felt, that we should give each other the space, or give them that time, and respect the fact they grieve in a particular way.
Thank you. I really appreciate what you've just said, because that's pretty spot on. And I also want the group to consider the fact that not every relationship is a loving relationship. And not every relationship, is going to result in the kind of grief that usually gets talked about, right? So I've talked about it, it could be a conflicted relationship, or it could be that the person was suffering for so long that it's actually a relief when they die. And that relief is coming from a place not of apathy or malice. It's coming from a place of, I'm so glad this person is not suffering anymore, So it's a relief and a release for the family. And so, I'll share a personal thing with you before we close for today. I know we're over time. So I remember when when my mom passed away now in February, Nepali Hindus are very, very strict Hindus, but we decided she was our last elder. And after we did the ceremonies in the way that would have made our ancestors proud. But rather than doing the whole 13-day thing, after the Shanti Puja on the 4th day, we decided to throw a big party. And we threw the biggest party where we got all our family members to cook all my mom's favorite food, including meat and this and that and whatever else. And I can tell you, a lot of people really disapproved of the way we did it. But what we chose to do was to celebrate her life. It doesn't diminish the fact that, how each of us felt about her. And certainly, I mean, we did try and adhere to the norms of society. But at the end of the day, that party, so to speak, was more of a family gathering. It actually gave permission to people to share stories about her. And by the end of the night, we'd heard some incredible stories. And those aren't stories that I think we would have heard in a quiet, in a puja setting. And it's come out in this way. We've all documented it. I think we're all better for it. And so how people choose to express their grief is very different, and we need to respect it. And if somebody, like Neha said, if somebody chooses not to be public about their grieving, we need to respect that as well. So I'm going to stop with that, and I will request that all of you put in a word in the chat box right now, because we've spent the last hour and a half talking about some very possibly disturbing stuff for some of you who are, especially those of you who are reliving some of your grief, perhaps. I hope that some of the tools here will, or at least the frameworks, will help organize our sense of what we're experiencing if you're experiencing grief. But I will ask you to put in a checkout word in your chat box at the moment, and it'll give me some time to just go through some of the things that people have shared in the chat box also. Okay, so very quickly, we'll see ourselves out, Shri. See you all on Friday for the second half of this session.
Radhika, would you like to add any?
Sorry?
No. Anybody has any queries or anything? Or
Yeah.
shall we start?
Okay. Just a doubt on stages of grief. Is bargaining only listed or seen as ways to cope with death? I feel like bargaining and denial, while different, can also be looked at as similar in this case. Deepak, can you please elaborate on this so I can understand the question better?
Deepak, if you're trying to communicate, you're muted, I guess.
So let me just step in. Bargaining in this context is like, okay, God, please let me live till my daughter's graduation. And I promise I will do X, Y, Z. If you let me live till, if you let me live till my daughter's wedding, I promise you I will give up this, or I will do this, or I will become a better human being. I mean bargaining in that sense. So yeah, I can see that. Deepak, do you want to say something? Oh, his unmute is not working. So tech team.
We are looking into that actually. So I couldn't find any issue from our end.
Okay. So if I were to try and understand this.
Maybe we can take
okay, I got it. So bargaining is as an overlap of denial. Like, I'm not completely accepting this to be true. And I believe that if I can bargain, then I can get an extension on my expiry date, so to speak. So is it a form of denial? It could be viewed as that very well. But it is also a way of coping. It's both. It's both, Deepak. It's my way of trying to, it is a kind of magical thinking. And very often it's this idea that, and I think we do this on a, if I do this, then maybe I'll be able to do this. Or if I do this, if this happens for me, then I'm gonna give up meat for like for or I'm gonna give up a particular bad habit if I get to do this. So we make all these, we make bargains with God quite often. So it's a coping mechanism, as well as it could very well be a manifestation of denial. Yeah.
Can you hear me now, ma'am? I'm chatting from Agash's phone.
Oh, okay. Yes,
Yeah. Yes, ma'am. The examples you said forth, while it was valid, what I meant was like when after the death, like what you said was, please God, if you let my daughter live, I'll do this, I will do that. And those also, yes, like you said, it's a way of bargaining. What I asked was it only as a stage of grief listed only as that, or after the process, or what we view as death? Would it also mean that would people or their families talk to each other or try to come up with some way of coping with the death or the loss or something like that? I'm not sure that you understood me right now. But what I asked was after death, not during
After
a
death.
process, not during a medical procedure or during a critical time in somebody's life. After death, does that come as a critical stage in after death? Because denial, anger, and everything else, they do come. That's pretty obvious. It's just highly connected to emotions and um, all the other such things. But after that, how big of a role does bargaining play after that? That is basically what I want.
Okay, got it. Finally, thank you. I got it. Yes. So I don't think it plays too big a role in the way that Elizabeth Kubler-Ross meant it post-death. I'm going to have to think about this one, actually. You've given me something to think about, because I've never thought of bargaining from the perspective of a bereavement factor. I've usually seen it in the process of, in the stages coming up to end of life. So I'm going to have to think about this, Deepak. Is that okay? Because let me just look through, let me do some research. Thank you for that question. I don't think I've ever been asked that question before. So thanks for the food for thought.
Ready for this? Sorry for the trouble, but that would be splendid.
No trouble. Best part of these classes is I get to learn as well. All right. Thank you. Thanks very much, everybody. Have a good afternoon.
Thank you, Smriti ma'am. I had always personally admired your capacity to deal such delicate topics with such, you never disappoint anyone, and you make everyone understand what is to be understood precisely. Thank you so much. Keep
Thank you,
improving.
Shripriya. I'm not, by the way, I'm not bribing Shripriya to say that. Huh?
Of course not. I wish she could bribe me, but she has not bribed me till now.
Okay, I picked up on that hint. Okay, thanks. Thank you, everybody. Bye. Take care.
Take
See you
care,
next.
everyone. Till we see in the next session. This is Sri Priya along with Ms. Smriti Rana and Ms. Radhika signing off from the Tipsy Poha. Till we meet again, take care. Bye bye.